Welcome, and thank you for joining us today for Making the Complex Simple, Practical Strategies for Managing Benefit and Retirement Plans. Quick housekeeping. Today's session is being recorded and the link will be shared following our broadcast. We will also have a short survey at the end. We'd appreciate you taking a moment to complete it. I'm pleased to introduce our moderator, Kristen Slana, Vice President, Employee Benefits and Retirement Client Strategies, who will be guiding today's conversation. Joining Kristen are Jim Yee, Vice President, Group Retirement Services, Leanne O'Brien, Vice President, Health and Benefits Consulting, and Lisa Di Domizio, Senior Consultant, Health and Performance. We will be drawing on findings from HUB's 2025 Workforce Vitality Gap Index throughout today's conversation. I'll now hand things over to Kristen to get us started.
Thank you for the introduction. Welcome, everyone, and thank you for joining us today. Let's start where many benefits conversations begin. Why have benefits become so complicated to deliver? Consider your own workplace. 5 generations now look to the same program for very different things. Add rising expectations around mental, financial, and emotional well-being, and a plan that once felt straightforward quickly becomes overwhelming to manage. Most employers have responded by adding, not simplifying. Before we talk solutions, let's see what the data says. Programs are growing. Like we said, 5 generations now coexist in the workplace with varying needs. 72% of employers plan benefit changes due to the economic environment. Of those, 75% are expanding, not cutting. Only 42% of Canadian employers offer financial wellness tools, and only 28% offer EAP. But utilization isn't keeping up. 50% of employees say they would use well-being programs if offered. However, only 15% currently participate. 34% of Canadian employees say they need help with mental health and well-being, but fewer than 1 in 4 with mental health concerns participate in related programs. 22% of Canadian employers wait over 3 years to evaluate their insurance partners and benefit offerings. These numbers point to a real tension. Employers are adding programs, employees are saying they want support, but the connection between what's offered and what's used is breaking down somewhere. I want to dig into that with our panel today. Let's start with Jim. From a retirement perspective, how has the scope of what employers are expected to deliver expanded, and where does that create confusion for plan members?
Great question. Yeah, from a retirement perspective, there's a couple places I can go with this. First, there's a set of rules called the CAP guidelines, and CAP stands for Capital Accumulation Plan. And so these guidelines apply to all pensions, group RSPs, and other retirement plans. And it's in September of 2024, these guidelines were updated after 20 years of no updates, which places more emphasis on how these plans should be governed, monitored, and basically run. So employers, first and foremost, should be aware of these guidelines and their responsibilities to oversee, monitor investments, provide communication to employees in reviewing their plans. And if they're not aware, they certainly talk to your hub broker about what these plans mean to you. The second perspective is because these plans are exactly that. They're just a set of guidelines. Not all employers actually follow the scope of a group retirement plan and follow the required governance. So for most organizations, the group retirement plan is kind of viewed as an extension of the benefit program. And often these retirement programs are not reviewed regularly and properly. And many of these plans, what we see is they run on autopilot, and they've been running on autopilot for years and years and years. So personally, I'm a little biased, but I'd love to see more priority placed on reviewing their group retirement plans. And now there's a structure that's been updated for employers to follow these guidelines, follow this structure. Retirement options today are so much more advanced than they were 10, 15, 20 years ago. And so reviewing a plan can just be so positive to both employers and employees.
Thanks, Jim. Lisa, when you look at employee well-being programs, what explains the gap between availability and utilization? Is it the programs themselves or how they're being delivered?
Thanks, Kristen. It's actually rarely the number of benefits, resources, so the overall program that's offered to employees that's the challenge. What we see is that most gaps between the program and utilization come down to three things. Do the employees even know it exists? Can they figure out easily how to use it? And can they see themselves in the situation? Can they see how this benefit applies for them in their specific need? So let's jump into these barriers a little more. If we look at the first barrier of awareness, employees can't use what they don't know about. Benefits communication is often buried deep on internet pages or introduced once at the time of onboarding and not repeated, revisited by the employees themselves. It's a PDF that's gone on, lost into space. And if we think about it, think how often our organizations are committed to communicating strategically in a planful way with employees around their benefits and resources available. Is it once a year? Is it at the time of annual enrollment and then it disappears? On the health and performance team where I work, which is the cross-section of individual health and organizational health, supporting employees' performance in the workplace, what we see is a pretty consistent pattern of limited, unfocused communications being sent on an intermittent basis. So there's no consistency in how employees can expect to see the information. And thirdly, the last one is, do they see themselves in the barrier? So you want to frame the positioning. This is the one that gets underestimated the most. We often send out communications that are in and around, use this benefit, access your EFAP, do you know about your retirement savings? But if we look at the report that we're diving deep on today, we know that 80% of employees who indicate they have adult caregiver responsibilities feel that these adult caregiver responsibilities are impacting their productivity in the workplace. So how about a focused communication regarding our EFAP resources that speak specifically to caregiver communications and supports available to employees in the workplace? So instead of sending a generic message, the information needs to be framed in and around a direct concern. This can be applied to Jim's example of financial stressors. We know early employees, younger in their career, they have challenges, or mid-career employees, they have relationship and parenting challenges. Specific focused messages will help that gap with respect to utilization.
So much to think about. Thank you. Anna, from a plan design perspective, where do you see the most accumulated complexity? What's changed in the last few years that's made benefits delivery harder for employers to manage well?
Thanks, Kristen. Lots of commonality here with Lisa and Jim for sure. I think we would start with, really years ago, a core plan had drugs, dental, life, LTD. Now we're layering in EFAP, virtual health, mental health platform, women's health, and oftentimes each edition comes with its own communication, vendor relationship, and administration requirements. This brings in complexity in administration and higher costs to the benefit portfolio. So when we think about benefit budget, those budget lines are hitting the radars of financial teams more intensely now, and the financial management of benefits has become so much more intense. So we're talking about forecasting and the need for business cases for increased cost, and we know that we get increased cost all the time. But what really has changed the most in the last few years is employee expectations. As you stated, Kristen, 5 generations in the workplace now means 5 different sets of priorities. A 28-year-old and a 58-year-old are not reading the same booklet the same way. They are looking for completely different things. What I often see when plans grow organically, like a benefit added or a vendor change, no one sits back and asks whether or not the whole thing still makes sense as a package. And without clear objectives, guiding principles, coupled with employers waiting too long to evaluate the plans, complexity does take over.
Thank you. So if complexity is the problem, simplification is the answer, but there's a real risk, stripping out value instead of clarifying it. The goal isn't an easier plan to administer. It's one that works better for the people it serves. That means understanding what they actually value, which often differs from what employers assume. Here's the uncomfortable part. If you're designing on assumptions for the average employee, this often means the plan works well for no one. Financial stress is the #1 concern employees report, and it doesn't stay in one lane. It spills into health, productivity, and engagement. Yet the support on offer often isn't reaching the right people in the right way. What employees actually value is 40% of employees rank flexibility and work-life balance as their top value, ahead of compensation and job security. 73% of employees say a comprehensive, personalized benefits program would increase the likelihood they would stay. 80% or more of employees aged 25 to 34 say they would be more likely to stay for personalized benefits, where employers' assumptions diverge. Employers are split 3 ways. 33% say employees value job security most, 31% say flexibility, and 31% say compensation. Employees are not split. 40% chose flexibility. 32% of Canadian employers have not revisited their plan design in 3 or more years. Only 42% of Canadian employers offer financial wellness tools. The employer split is worth pausing on. Employers are spread evenly across job security, flexibility, and compensation, while employees land decisively on flexibility. That distance between assumption and reality is a gap, and it shapes how plans get designed. Let's take it to our panelists. Lisa, from a health and performance perspective, when plan design doesn't account for what employees are actually dealing with, whether that's caregiving, financial stress, or burnout, where does it show up in your data?
I think this is a great question, and it actually kind of links really well to what Leanna ended off with in the last segment, reminding us that the quality of the benefits in our plan and exactly what we just talked about need to be linked to strategies and objectives. So hopefully that's our starting point. We have some key messages, some strategies, and some key data points that we're looking at. And often it's in around participation and utilization. But we want to shift that a little, so we're looking at actual performance and what's impacting employees' health. And what we see in some of the numbers in the Hub report is that there's a bit of a disconnect there, because 42% of employees say their work is being impacted directly by their health concerns, but only 16% of employers feel that employee identified health concerns impact or are part of their top productivity factor. So how do we start to build that gap in our data and add that to our objectives and our strategy so we understand them? The first thing is take our traditional benefits data and look at it a little differently. Look at it at the population health level. So not how many claims you get in a year or what are the costs of those claims, but actually break it down to the number of employees submitting for expensive in a non-preventative or non-proactive fashion to help address chronic conditions like mental health, musculoskeletal conditions, cardiovascular disease, and anything that would be impacting their performance. So once you know what percent of the population is impact, that helps narrow down where you should be focusing your plan design. Then you can layer in the claims costs, and together they tell a robust story. Next, we want to look at the absence, leaves, and vacation pattern information that we have available for us. Often absence and leave data is left out of this picture in plan design, and absence and disability management is seen as a standalone. We think combining the absence and leave information with your population risk data really can show you what's trending in the performance of your employees in the workplace. Do you have unplanned spikes in absences around cold and flu season? Did you have a particular challenging organizational change that have impacted short-term disability patterns? Even is it a year or several patterns of years where you notice people are not taking their vacation? These can be indications of burnout or caregiving pressure, different challenges on the home front, combining with work factors. So we've got the population risks, we've got the absence and leave patterns, and then we want to look at some of our ancillary benefits. So for example, our EFAP utilization, what is the rate of usage? But further than that, what are people using it for? What are common topics and themes, and do we see repeat usage? So are people being serviced in the way they need? We want to get beyond, did they find the access point, and look at what are they accessing it for, and are our programs supporting that? And similar to that is virtual health. So that digital access makes things a lot easier, but this is a key important support about employee performance, and what are they accessing those services for that? Is it chronic condition prescription renewals? Is it just-in-time doctor visits for immediate needs like colds, flus, or injuries? And that can help address some needs in your plan design. And lastly, I want to talk about employee survey feedback. Data that tells you what's happening with your employees in their own voice is invaluable. When we combine our employee survey feedback with our overall kind of diagnostic trends and tools that we used with the absenteeism data, our population benefit trends, and our ancillary benefits, we're able to create a robust picture that helps us really understand where we should be focusing our plan design.
Thank you. Leanna, when you're working with employers to redesign their plans, what's the most common assumption you have to correct about what employees actually need? Where do you see the biggest gaps between plan design, intent, and employee experience?
Well, the most common assumption I have to work through is that richer plan is a better plan. More coverage, higher maximum, more categories. But richness without applicability doesn't really land. Employees don't value what they don't understand or can't access. The second one is closely related. So as you talked about, on our stats, and when we are assuming that leadership value is what employees value, right? So senior leaderships often prioritize retirement matches or certain LTD features because those things matter to them at their career stage. But a 30-year-old with a new mortgage, maybe a student loan, or starting a family is thinking about things very, very differently. So the data on this slide tells the story clearly. Employers are split on what employees prioritize, but employees are not. 40% choose flexibility. They want to be able to use the services that they need and also pay for the services that they need. The gap between design and intent, the design intent and employee experience shows up really in utilization. You can have the most beautifully structured EFAP program and have 3% utilization. That's not a program problem, it's a design and communication problem. So when I sit down with a client to talk about plan redesign, one of the first questions I ask them is, when was the last time you talked to your employees about what they actually need? Today, employees want to give their feedback. They want to be asked. They are comfortable sharing their opinion and asking for what they really need and want. They don't see it the way we did in past generations. They see it as really helping and improving. So the key thing to remember is that the fix is not always expensive. Sometimes it's about rebalancing or better communication. But beware, oftentimes we think about reducing coverage. Let's reduce coverage that we don't use. Well, if you reduce coverage that you don't use, you don't really save any dollars. It would be like me saying, hey, I'm going to take movie night out of my budget, but I don't go to the movie. So I'm not freeing up any dollars. So that's another thing you have to kind of watch for a little bit. But really, bottom line is determining needs, priorities, goals, and objectives is where plan design becomes a strategic conversation and not just an ad hoc conversation that can add complexity.
Thank you for that. Jim, retirement plan design is often one size fits all. What does a more targeted life stage approach look like in practice, and where does it create the most value for both the employer and plan member?
Yes, Kristen. So you shared a stat that 32% of Canadian employers have revisited their benefit plans. And in my experience, when it comes to group retirement plans, that number is considerably lower. One of the traditional approaches to customizing a retirement plan is to simply implement a tiering strategy based on tenure, years of service. So for example, if you reach 5 years, you might increase the matching from 3% to 4% and at different benchmarks and levels. And today, what we're seeing is some, forward-thinking employers are wanting to help employees, not just based on their years of service, but also on their lifestyle and stage of financial life. Leanna talked about the 30-year-old looking at retirement different than a 60-year-old. And it's so true that your financial priorities are so different when you're in your 20s, 30s, and 40s than you are in your 50s and 60s. And many of those young people are not thinking about retirement, and they don't care about retirement because of their stage in life. And so as a result, some employers are looking to make changes to their group retirement plan to reflect this thinking. And I call this a retirement flex plan, kind of like a benefit flex plan, where employers might give different employees different options from the employer match perspective. For example, for employees that value retirement and long-term savings, that traditional RSP or pension certainly makes a lot of sense. But maybe for younger employees, they might prefer to opt to have their contributions go into a TFSA, tax-free savings account, or an RESP, a registered education savings plan. Giving employees flexibility for their contributions, you have to balance this out because it may sound appealing, but employers need to weigh this against increased cost and complexity of administering such a plan. But the point I'm trying to make is these options exist now, and the traditional retirement plan of just everyone gets a 3% match. I know this session's called Making the Complex Simple, but sometimes the group retirement plans are too simple, and you can add complexity, a little bit of complexity, without complicating things too much. So I think it's great.
I love that input. Thanks, Jim. So plan design and financial well-being are closely connected, yet they're usually treated as separate conversations. I want to bring them together. We've established that financial stress follows employees to work. What matters now is the response. When we look at what employers actually offer and who those programs really reach, there's a significant mismatch. That's the gap I want to dig into. 49% of employees cite financial concerns as their biggest stressor at work. Of those, 60% say it reduces their productivity. 71% of employees aged 18 to 24 and 40% of those aged 25 to 34 report having student debt. Employees 25 to 34 report the highest levels of financial stress. Employees 55 and over report the lowest. 43% of Canadian employers offer personal wealth planning, despite it being the most meaningful financial benefit for employees under 35. 57% of Canadian employers offer retirement planning as a financial wellness tool, despite it being ranked most meaningful by employers 35 and over. 1 in 3 employees with student debt ranked education on managing day-to-day finances among their top 3 most meaningful financial wellness benefits. What stands out to me in that data is the life stage dimension. The tools employees say they need change significantly by age group, but most programs are not designed around that. Let's take this to the panel. Jim, when you look at RRSP participation patterns, where are the biggest drop-off points, and what does that tell us about how retirement programs are being designed and communicated? Where does the employer match story get lost?
Yeah, another great question. With group retirement programs, most of the plans are what we call voluntary. In fact, the data says that more than 70% of plans are voluntary, which simply means that employees can choose to join or not to join. And when the plans are voluntary, the average participation rate is about 60 to 65%, which I think is just crazy, because when I look at these group retirement plans, like this is what I call free money. Like why are so many employees not taking advantage of this free money? And I think that the answer to the question comes back to how do we increase participation? What allows employees to want to participate more? And I think there's a few things. One is, how engaged is the administration, and how passionate are those that are running the programs? We have some plans where the employer is very passionate, and they promote it, and they really want that participation level to be higher. The onboarding process is without question part of affects the onboarding and participation levels. We also see the type of employee and the type of business, where if you have a lot of employees that are in the field, communication can sometimes be challenging to get those people onboarded. Obviously, we see higher participation levels in office employees, white collar executives, things like that. So then that leads also to financial stability of employees. You definitely see, a drop off where employees have a lot of financial stress, cash flow stress, living paycheck to paycheck. And then I think financial education definitely plays a role. This is one of my areas of passion. The more education, the more promotion, the more communication you give employees, the higher level of participation. So if employers want to increase that participation level, some of these are the key areas to look at in terms of helping employees take advantage of that free money.
Thank you. That's very helpful. Leanna, financial stress doesn't stay in one lane. It shows up in benefits utilization, absenteeism, and claims. What connections are you seeing between financial well-being and plan performance on the health and benefit side?
Yeah, well, financial stress is genuinely systematic. So it doesn't present in one single claim or in one single absence. It really shows up everywhere and it compounds over time. So what we see in plan performance is two very opposite sides, really. First, we see elevated drug claims, particularly for anxiety and sleep-related medications in populations where there is high financial stress. It shows up in absences. So financial stress is one of the major drivers of mental health deterioration, and mental health is the leading cause of absence and disability. So people who are financially stressed are often dealing with practical crisis, right? A car that needs repair, a family member has unexpected expenses. And these people pull out of work in ways that we don't always code as financial stress, but that's really what's underneath everything. The other side of the coin is that really employees under financial stress often delay or avoid care. They skip their dentist appointments. They don't fill the prescriptions. They wait too long to go see a specialist. So the plan looks like it could be performing well as it relates to cost, but we're actually seeing deferred utilization show up in much larger claims later on. As you shared, really, like nearly half of employees are citing financial concerns as their biggest workplace stressor, and that is so concerning. And it truly is a plan performance story. Plan sponsors need to stop looking at these silos separately. Drug trends, mental health claims, absenteeism, EFAP utilization, and financial wellness. These are all telling the same story. And when you read them all together, you can actually do something about it. This is the data to build your business case for better employee health.
Great, thank you. Lisa, from a health and performance perspective, how does financial stress manifest in the workplace, and what does an effective employer response look like beyond offering a program and just hoping people use it?
Yeah, thanks, Kristen. And really well said, Leanna and Jim. We now really acknowledge on the well-being side of strategic planning and organizational planning to support health in your organization, that the financial pillar is one that's very important to address. And we would encourage you to make communicating in and around financial well-being as part of your overall strategy and key messaging as you look at the data that's impacting in your workplace. You have the hub report information that's pretty clear on the stressors in the workplace. We have kind of Canadian reference population data on the impact of mental health. And we have the information that we see daily in the news about the financial situation and financial stressors impacting everyone. What we want to build on that is, as Leanna said, the Canadian Mental Health Association has acknowledged a very clear link between financial well-being and chronic health management and overall health management. They actually call this financial health feedback loop, and it just continues to cycle. So without creating a strategic plan focused on communications, driving employees towards their supports and awareness of tools available for them to help manage their financial situation, what we see is an increasing concern in in overall health issues and ability to perform in the workplace when it shows up in the data, as Leanne indicated. So as a best practice, we can't leave financial well-being unaddressed because it doesn't stay in one lane. It needs to be acknowledged and identified as a very important pillar in our planning and part of our overall strategic priority in health communication and well-being for employees.
So much great information from all of you on that topic. So everything we've talked about so far, plan design, financial well-being, utilization, it all requires measurement to move forward. If you do not know whether your program is working, you cannot improve it. So the right metrics cut through the noise and tell you where to focus. If you're not measuring the right things, you're operating on assumptions. The data on this is both encouraging and a little uneasy. So 82% of employers believe their benefits programs reduce stress, boost productivity, and improve overall wellness. However, only 63% of employees agree. That's a 19-point gap. Workplace culture ranked last by employers out of 8 factors impacting productivity. Employees ranked it 4th. Only 16% of employers believe health concerns are a top factor impacting productivity. 42% of employees say health concerns impact their productivity. Now, what employers are using to make decisions. 64% are using employee satisfaction surveys, 60% internal HR guidance, 60% industry benchmarks, 50% employee demographic data, 36% employee utilization data, and 30% insurance broker and carrier guidance. That 19-point gap between what employers believe and what employees experience is not an alignment problem. It's a measurement problem. Employers are making decisions with confidence, but without the right evidence. Let me ask the panel what to measure instead. Leanna, when you sit down with an employer to evaluate whether their plan is working, what are the first 2 or 3 data points you look for, and what's most commonly missing?
So the first thing we look to is understanding our workforce and their personas. So we want to know and understand our population. Then we look at utilization, not just overall claims cost, but who, meaning what population is using what and what population isn't. Low utilization on a benefit that was supposed to address a specific need is really a red flag. It usually means maybe a communication problem, an access problem, or possibly a design problem. Maybe your employees need something different than what you're delivering today. The second is kind of the trend behind the trend. So we think about, okay, our drug spend is trending up, right? It doesn't tell you much. But when we start looking at therapeutic categories, we are starting to see growth in mental health medications, in chronic disease management, and possibly even in lifestyle drugs. We add in population data, and that starts to tell us where our population is actually heading. So you got to really kind of look at the two. We look at disability experience, so not just incidents, but incidents, durations, return to work rates. All of those things are very important. We all know that, LTD is a lagging indicator. Your leading indicators are really what's happening in your health plan, the health plan usage, your short-term absences, and your EFA pay usage and patterns. So the two things that most commonly are missing is really that, we're not seeing employee segmented data that's actual and specific. So what often is used is very generic data, and that sometimes doesn't really tell us what we need to know about our plan. The second piece of it is connecting the plan data, so your usage data, with your HR data. If you're not looking at benefit utilization alongside absenteeism, turnover, productivity metrics, like Lisa had indicated, you're not seeing the full picture. The 19% gap that you spoke about, the 82% of employers think that their plan is reducing stress and improving wellness, but only 63% of the employee agrees. That gap exists because employers are measuring the wrong things, or they're not measuring at all. So the goal is not really to drown in data, it's to identify those 2 or 3 key identifiers that actually tell you whether your plan is doing what you built it to do. And of course, you have to check those consistently.
Thank you. I love the way you explained that. Jim, retirement plan measurement often starts and ends with participation rates. What other indicators should employers be tracking to know whether their retirement program is actually supporting their workforce?
I love and hate that question at the same time. I hate it because it's really hard to answer that question. You know, when you think about tracking financial improvement, it's just so hard to track, especially for an employer, because finances are impacted from so many facets and areas of life outside of the workplace. So the workplace is just one of many influences, you know, that help with financial success and fragility. But I do love the question because I think the answer really lies in data and analytics, which the panel has talked so much about. And I love that Hub is become such a leader in emphasizing data and analytics. And so one of the things the employers can do, and Hub has a great new tool called the GRS Group Retirement Services Persona, which again helps employers identify the employee makeup of the workforce. And when I think of financial health or financial success, there's the financial stages of life, and we all go through those stages of life. And the persona helps employers to identify the different employees in the different stages, financial stages of life that they're in, and that can help them with design and education and communication. You know, for example, if you're an employer and you have a large segment of employees that are under 40, as I mentioned before, retirement may not be top of mind when it comes to finances. And so employers might look to things like education and information and plan design and help them with other financial issues like buying a home or dealing with mortgage renewals, managing debt, children's education, cash flow, you know, things that are more relevant to that group and their financial stage in life. So I think the answer, you know, lies in some data and helping understanding the employees and what stages of life they're at, and that can help employers understand some of their financial issues and struggles, and it will help both employers and employees in terms of implementing the right group retirement plans.
Thanks. I like the fresh lens you're giving on building retirement programs that are, you know, typically so traditional. Lisa,
Sure.
from a health and performance perspective, what metrics help identify whether well-being programs are making a difference, and how do you distinguish real impact from participation counts?
Thanks, Kristen. This is really, again, where we bring everything that Leanna and Jim said together. And starting off, what metrics indicate a distinguishable difference really are impacted where you are on your strategy. Question 1, do you have a strategy? Have you created clear objectives around that strategy? Do you have real goals and metrics? And do you have communication planning? In a first step, we talked about those first 3 barriers. So are we trying to address awareness, removing risk to access, and creating a vision of the employee self and the information? If that is where we're at in the initial stages of our strategy, then participation is probably one of our greatest indicators. But as we start to evolve our strategy and we keep monitoring and we develop it, we want to get, I don't want to say a little more advanced, but we want to get a little more strategic in creating that linear determination on if our programs and efforts are working beyond just I attended a webinar or I called in for a single EFAP service, so I know how to use the phone number. First, we want to look at our chronic condition management outcomes. Are employees engaging in some of these programs that we have supporting chronic disease or mental health? And are we seeing this usage leading to clinical indicators improving over time? So what I mean is, do we see a decrease of our population in certain areas, or because of awareness, do we see an increase in some of our preventative services in certain areas? If we look at our absenteeism data, return to work speed, are we decreasing our duration in and off work, and our sustainability of return to work? Are people coming back from work, from leaves to work and staying? Or do we have repeat cases? So that's an indication of if our plan is working. Benefit utilization shifts more towards preventative services and costs. So some of our paramedical services, some of those services that focus on having early intervention and early care before it leads to a significant illness. Employee reported well-being scores. This links back to over that employee survey data. Do we include some well-being score data? Do we include some benefit perception questions in our data in our employee survey? And are we getting that back to us? And lastly, retention and productivity trends. This is one that's often overlooked because it's a bit of a lagging indicator, because you see it when people are leaving organizations. But the Hub report shows that 73% of employees are driven to stay in an organization and around the benefits offered to them. So if we're if we're tracking the exits and the opportunity, it helps links information into the already robust trending information that we've developed. But again, the main message is it depends on where your strategy is. Start with participation and evolve from there.
So many great tips. Thanks, Lisa. So we've covered plan design, financial well-being, and measurement. This final piece is the thread that ties them all together. You can get the design right, offer the right tools for the right life stages, and measure what matters, and still fall short if employees don't understand what's available or why it's relevant to them. A plan employees don't understand is still a complicated plan. Communication is what turns a good program into one people actually use. So let's look at the stats. 72% of employers rely on information packages from benefit providers as their primary communication channel. 72% use written internal communication such as newsletters, intranet, and email. Only 44% use personalized communication. Only 40% use live virtual presentations. Only 34% use video content. 50% of employees would use well-being programs if offered, yet only 15% currently participate. 30% versus 70% generic benefits communication achieves approximately 35% effectiveness compared to roughly 70% for personalized communication. The dominant approach is still one directional and generic, and the data shows it's not reaching employees. So the question is what effective communication actually looks like in practice, not in theory, but something employers can act on. Let's ask the panelists there for their input. Lisa, when you see employers struggling with employee engagement in their well-being and benefits programs, how much of that is a program design issue versus a communication issue? What does effective benefits communication actually look like in practice?
Great, thanks, Kristen. We started off with the top of the webinar calling out the fact that it's often not the program design, or it's not always the program design. And we make that assumption if they don't use it, they must not want it. And that's not really the case. When utilization is low, we need to look at both design problems signals and communication signals. And it's usually the communication that gets underestimated because we don't have the time and effort to put towards it. Let's talk about design program signals. What do they look like? Well, utilization is low. So people are accessing it, but they're not accessing it repeatedly. So we can find our way to the resource or benefit, but we don't use it in a repeatable fashion. The offering doesn't match what it actually needs, and accessing it increases and drives the stress in your population. So, an example is you launch a new resource or benefit, you see that initial spike in utilization, and then you see a trending drop off and it goes quiet. And then no matter what dedicated communication or information plans you have coming out, you don't see that increased utilizations. Whereas in a communication problem, the first step, where is it occurring? We don't have a planned communication strategy. It's not intentional, it's communication. So therefore employees don't know the benefits that exist for them, and they're surprised to learn about them, and they assume that it didn't apply to them. So we got two very clear different areas: design problems and communication problems. Now, the good news is we can address both through focusing solely on communication. And I want to highlight 5 tips or 5 ways to consider your communication plan that can really help solve this issue. As we've said repeatedly in the webinar, it's not a single communication campaign once a year, like an annual enrollment email, that's going to address it. You have to have an always-on strategy that reaches employees at moments of relevance, manager conversation about workload, a financial wellness nudge when cost of living pressures are visible in the outward world, or caregiving resources sent when an employee automatically takes leave. So we want to look for natural points of communication where we are already going to be communicating in our workforce with the employee, that we can add enhanced information about our benefits and resources available to them. And that links into the segmented data that we talked about, and people seeing themselves in the benefit or the resource that we're highlighting. So we're making sure it's persona based, because we're linking back to their experience, and they're getting the information they need in a way that they understand it contributes to their specific concern. And you want to be specific and concrete, right? So when we're doing that, so it's not just about call your EAP, here's the phone number. It's, we understand you may be having challenges around caregiving resources. We understand you may be feeling financial stretches. Did you know that our EFAP provider has these specific programs available for you? And you're able to access them, and then always reconfirm how they can be accessed. That bears repeating, because we know people take a just-in-time approach. And so you don't want to miss the opportunity of, 1, telling them about the service, but then 2, forgetting to remind them how to access it. Use trusted messengers. It doesn't always have to be a centralized HR communication model, not always a single email. Take a varied approach. And I would say focus on your people leaders. There's power in your people leadership, understanding everything that's available to them to support them in their day-to-day health experience, but also understanding how it can be framed to support their employees based on their supporting experience. People tend to see their leaders as trusted individuals, and when you're hearing about information or a great support or something that's available to you from your leader, you may be more likely to access it. And the last thing is, it harps back to what we've talked about a few times: data. Measure and address and track your awareness. So what you want to do is create clear metrics so you can understand if it's a plan design or it's a communication issue, and then monitor them and take your feedback and adjust accordingly. Be strategic in your approach so that you're making informed decisions.
I like that piece on trusted messenger. I think that's a good tip. Leanna, from a plan design perspective, where have you seen a communication strategy make the difference between a plan that delivers value and one that doesn't, even when the underlying design is strong?
I was hoping you'd ask me next, Kristen. I wanted to say, yeah, what Lisa said. She stuff so great, without a doubt. Really, I think the clearest example I can come back to is the EFAP. Almost every employer has one. Most employees can't tell you what is covered, how to access it, or even if it's available to their family members. The program's there, the value's there, but without the communication, and like Lisa said, without communication that's, in my words, specific, regular, and human, it doesn't get used. So I've worked with many clients with strong plan designs, good coverage, competitive benefits, really where the employer is making a real investment. But year over year, we're hearing that the employees don't feel that the plan was meeting their needs. And when we dig into it, the issue is almost always communication, especially when we're talking about good plan designs. People don't know what they had. So the fix isn't, redesigning plan, is changing how we explain things and moving away from that annual benefit booklet, like Lisa talked about, and building out a calendar of touch points, new hire orientation, life event triggers, all those type of things that we've discussed. And also in-person benefit sessions. We have to know our population. We have to know our workforce. And we did some communication. It was in the utility sector here not that long ago. It was a situation where great plan design, but people weren't happy. And, it was what really made the difference for that cohort was in-person benefit sessions. That's what landed for them. It doesn't land with everybody, but it certainly landed with them. So, you kind of talked about it, in the data, it really is clearly said that generic benefit communications achieve about 35% effectiveness compared to the 70% for personalized communication. That's the difference between a benefit plan that lands and one that doesn't. So 44% of the employers are really leaving their benefit plan impact on the table, not because the plan is wrong, but because the messaging to the people isn't relevant to them. So plan design and communication strategies have to be designed together. A well-communicated, simple plan will outperform a sophisticated plan that no one understands every time.
Thank you. And last but certainly not least, Jim, retirement communication is notoriously challenging, especially for younger employees who may not see it as relevant. What approaches have you seen work to close that engagement gap, and how does communication connect to participation rates?
Yeah, so I think I'm going to on just I mean, Leanna and Lisa were so thorough with their responses. It's to me, it is about messaging. I think for many younger people, the term retirement is not relevant. It seems so far away. I'm getting close to my 60s, and my wife and I, we talk about retirement all the time. It's every week we're talking about it. And but when I think back to when I was in my 20s, I was focused on, I want to buy a nice car, and I want to save for a house, and how do I go on a nice little trip with the money I have, and so retirement was just not even relevant at that stage. And so I think sometimes tweaking the message or the wording it makes it more psychologically relevant. And we've all heard, the younger you are, the more important it is to start early and things like that. But maybe the communication message, we've been battling with this idea since I started my career years ago. And so when we talk about retirement plans to younger people, we don't use the word retirement. We think about terms like taking control of money or improving your finances or financial independence, things like that are not just about 20, 30, 40 years from now, but things you can do today to improve your finances. And finding these terms and finding the mediums and things that the younger people can relate to will help them see value, not just in your retirement programs, but just seeing value in what the employers can offer in all of their benefits. And so instead of a one size fits all communication, tailoring communication, the messagings, the mediums to different groups, I think can make a massive difference to the success of your benefit plans.
Those are great tips. Thank you. Thank you, Jim, Lisa, and Leanna, for such a rich conversation today. Unfortunately, we are out of time for questions from the audience. However, if you have submitted a question to the chat function, rest assured your dedicated hub contact will be in touch with you directly after this webinar. Quick final reflections from the group. Before we close, I'd like to give each of our panelists one last word. If there was one thing you would want attendees to remember from our discussion today, what would that be? Let's start with Jim.
For me, from a because I focus on group retirement plans, I think for me it's really that for employers who have group retirement programs that may not have been reviewed or looked at in a long time and have been on autopilot. There are so many things, different options and ways to improve your group retirement programs today, whether it's about communication, plan design, matching, customization to different segments of an employee, even data sources now. So I would encourage you, if you haven't reviewed your group retirement program in a long time, now is a great time to do it.
Thank you. Leanna.
The most valuable thing I think a plan sponsor can do right now is close the gap between what they assume their plan is doing and what employees are actually experiencing. That gap, that 19-point gap we talked about today, is it a design failure? Is it a knowledge failure? You need to be using the right information in order to make the right decisions. and know the answer to that. So what I'll leave you with is go find out. Talk to your employees, look at the utilization data, sit down with your consultants and ask those hard questions like, is the plan working for the people it's supposed to serve? Benefit programs are a real investment. They deserve the same attention you apply to any other strategic spend.
Thank you. And Lisa.
Following what Leanne and Jim just said, I think it's really clear that being strategic, communicating with intention, reviewing our data, making adjustments, and engaging and supporting our people leaders, all with the goal of meeting the employees where they're at, is really the best way to understand how to improve the overall health and performance of your employee population and to ensure your programs are focused and invested in the right way. Organizations that do this consistently are the ones that move the needle on supporting employees' well-being and performance and reduce their health risks in their employee population.
Hey, thank you. Now let's bring it all together. Complexity is rising, not falling. We talked about 5 generations and expanding programs. Design starts with what employees actually value. 40% rank flexibility first, 73% would stay for personalized benefits. Financial well-being is the top concern, but the tools really aren't reaching the right people. The right metrics cut through the noise. Keep talking about that 19-point perception gap shows confidence without evidence is a risk. Communication turns a good plan into an understood one. Only 44% of employers personalize it. Year-round targeted engagement closes that gap between what's offered and what is used. I encourage each of you to pick 1 or 2 of these actions on the screen to start immediately, rather than trying to tackle everything at once. Assess your plan's complexity, where a program's grown without a corresponding review of how they are delivered and communicated. Understand what your employees actually want. Connect financial well-being to plan performance. Look at GRS participation rates, benefits utilization, and absence data together, and re-envision your communication strategy. Before I hand it back to our moderator, just a brief word on how Hub fits into all of this. Everything we've discussed today, simplifying design, connecting financial well-being to performance, measuring what actually matters, and communicating it clearly is extremely hard to do alone. It's also the everyday work of our teams: health and benefits consulting, group retirement solutions, health and performance solutions, data analytics and benchmarking, communication and design, and increasingly bringing benefits and retirement planning together into one integrated picture. What matters most to me is that you leave with the ideas and the questions they raise for your own plans. But if something today struck a chord and you'd value a thinking partner to work through it, that's exactly what we're here for. The QR code on the screen is simply an easy way to keep the conversation going whenever you're ready. That brings us to the end of our content today. I want to thank Jim and Leanna and Lisa for joining me. Back to the moderator.
Thank you, Kristen, and thank you so much to our panelists and audience today. A quick reminder that we will be sharing a recording of today's broadcast within a couple of days. Please share it with your colleagues. If you raised any questions we didn't get to, rest assured a Hub advisor will get back to you. One more thing before you go, a quick survey will pop up. Please take a moment to complete it, as we greatly appreciate your feedback. This now concludes today's broadcast.